So, as we've heard, burnout is a huge contributor to nursing shortages and the inability for hospitals to keep their floors fully staffed, which just contributes to more burnout as nurses who stay on the floor are overworked. So, finding sustainable and easily integrated ways to prevent burnout is key in maintaining staff and creating a happier work environment. Meditation has been tested as an intervention with promising results. Evaluating the evidence that we found, every evaluated study showed positive results in terms of meditation programs reducing feelings of burnout among critical care nurses. So the programs were successful. They are also very simple, as most successful programs only require about 3 to 8 weeks of intervention, which gives nurses the education and resources that they need. And then the hospitals or whoever's providing it doesn't have to take months on end doing this training. It can be just a few weeks and even just once a week during that time. As far as sustainability, the articles found that even after the studies had finished, nurses reported more positive feelings weeks and even months after, showing the long-term success of this intervention. And all of this information mainly comes from a 2025 systematic review that's called A Systematic Review of Mindfulness-Based Interventions to Reduce ICU Nurse Burnout. And this is a really strong source of evidence, and it was the main one that we looked at. But additionally, we found a lot of moderate and strong evidence that focused on individual studies, and this also supported these findings of it being successful, simple, and sustainable.
The setting for this program would be the hospital, and some current practices I've noticed in the research are that studies tend to focus more on nurse ill-being or what's going wrong for the nurses, such as burnout, while the opposite, or those sort of success stories of nurse well-being that show resilience, positive health, work-life balance, and just general flourishing are more understudied. The desired practice would be to shift our focus to these goals and recognize mindfulness-based interventions, or MBIs, as a possible key to this lifestyle. With their implementation, it would be important to structure it in a sustainable way, like the 3 to 8 week programs that showed some success. And it would also be important that the hospital was part of the facilitation by allowing nurses to take time out of their regular shifts to participate and organizing it in a conducive way to limit any barriers to nurse participation. And the ultimate goal is for these practices to embed mindfulness into the everyday life and workflow of these nurses and their hospital environments.
Okay, for implementation, we decided to implement our plan using the Plan, Do, Study, Act model from the Johns Hopkins text. And this plan, we're planning to implement it on a small scale with 1 or 2 floors participating initially, just so we can see how things are going. And then the results of the pilot program will then be analyzed and used to implement quality improvements into the plan so that it can be implemented at a larger scale throughout the hospital to benefit other nurses. And then the nurses who participate in the pilot program will help by reporting on their experiences with the meditation program so that we can see where it needs improvement, where things aren't working, or where things are working well, so then we can readjust the plan and implement it on a wider scale. And then as for the actual action plan, the plan is to implement an 8-week program for nurses on the floor, where they will take 30 minutes during a shift once a week to participate in mindful meditation. And the meditation will be done in the afternoon when the floor is a little less busy, so that the nurses feel comfortable leaving and going and doing their meditation. But the current research and practices that we found indicate that this is the most effective way to implement this change and to see the lasting results, because you're able to associate the meditation with the stressful experience of a shift. So you're able to put those things together and feel more calm outside of that time of meditation once a week.
Okay, so here we have our little slide on feasibility. This is where we're talking about, is this actually going to be able to be implemented? Are we actually going to be able to bring this new procedure into our hospital settings? And so we have listed here several different areas where we're checking for the feasibility or our ability to accomplish what we need to. The first being technical, right? What new technology would we need? Would it be a problem to have to acquire that? The best part about our process that we're implementing the meditation is that there's no new technology that's really needed. Everything that we have is perfectly adequate, and honestly, the only thing that would need to really be provided for the nurses is a space for them to participate in the meditation. Financially, there's not really a big contribution that needs to be made on the part of the hospital. And quite honestly, if they are able to more fully implement it and the outcomes that we're expecting for patients as well as for the nurses' general health, will be able to make it a cost-effective process that may even allow for some cuts in the way that some things are done. As far as scheduling goes, this is the area where we might see the most conflict, as there is a culture where many nurses feel they don't need to take breaks. So this is where most of the work will probably need to go into. Quite honestly, though, most units are able to set their own standards and implement their own organization. And so if we present this to them and allow them to take it and then implement it however works best for them on the specific unit, we stand to see more success with all that we're doing. And if there needs be, we can also recommend, if they feel like they aren't able to leave the patients for that long, they can have a float pool nurse be added onto the unit to help to mitigate the 30-minute breaks for the different nurses in the middle of their day.
Before we can measure the success of our intervention, we have to define our goals. So our goals are a decreased rate of burnout among the staff, increased patient safety, staff appreciation of the intervention, and a culture of self-care. We believe that it's really important that we measure the success both in quantitative ways and qualitative ways. So some of the quantitative ways that we are going to measure the success is by using the professional quality of life scale to assess burnout before the intervention, during the intervention, after, and then a few weeks after to assess how big of a change it had. We're also going to track retention rates, sick days, and missed shift counts, participation data of the nurses. We also want to track medication errors and falls numbers before and during the intervention. And then we also want to track patient satisfaction and the differences that our intervention has on patient satisfaction. In terms of qualitative data, we want to have a staff survey. We also want to have suggestion boxes during the activity in case they have any comments, things they want to change. We also would like to have our nurse educators or nurse managers interview our staff, and a wellness committee made from the staff on the unit that will contact the nurses every 3 weeks. And in terms of sustainability, we believe that this data, previously mentioned, will help us measure how sustainable our intervention is. All of that feedback will help us assess if it is something that we can or should keep on these units long term. So especially staff adherence and input, the burnout score improvement, patient safety, and the feedback from our leaders and our committee will help us determine how sustainable this intervention is. Thank you for watching our presentation. This has been a presentation on the effects of meditation on nurse burnout by Clara, Savannah, Maya, Paige, and Sam. Thanks for watching.